Amazing.
Tells you something
Wonderful.
about the bill.
This has already sailed through the House.
It is through the House. It is, where it passed. It just passed Senate Health and Human Services. It is on its way to appropriations, where it's expected to pass, and will probably be on the governor's desk, unless, privacy advocates start getting up in arms. What I find so dishonest about all of this too is this is the same state that worried last year when we were talking about the Taxpayers Transparency Act of 2009, B.J. Nichols' fabulous bill, so worried about privacy for people who might...
This was making public records that the government has more public, and people in government saying, no, we'd give out too much personal information about government employees, what they make.
Yeah, we don't want that. We don't want people to know what they make. It could be... It could upset somebody. Or what if, there's...
And let's remember, this is the exact same legislature. So the same legislature that killed transparency looking into government is now passing transparency prying into your doctor's office.
They created only aggregated information, so we couldn't see detailed records of how the state spends our money. But this database will be detailed information, encrypted names, things, names and social security numbers.
But we don't know. That's meaningless.
Yeah, it doesn't. Yeah. I mean, there will be enough identifiers in there. If this database is going to be useful, there will be enough identifiers in there that you can, and you will be able to identify an individual. And it's been done before. People have done this with databases before.
What is entertaining, if it weren't so very dangerous, is that the left, who doesn't trust corporations, is now mandating that people must buy things from big corporations. Liberals who rightfully don't trust the government are now trusting the government to handle every bit of communication between you and your doctor and put it there. And I'm wondering, wait a second, where are the liberals in this, wondering what's going on with Obamacare? Let's bring it over here and let's bring it a little bit back to Obamacare and how that affects Colorado.
Well, Obamacare affects Colorado because basically it's about the destruction of private insurance companies.
How? I mean, at first glance, this requires everyone to buy something from a private company.
But it requires you to buy something that's defined by a government committee, which means that it's probably not going to be anything anybody can make any money selling. When they passed almost the identical set of controls in Massachusetts and New York, all of the private insurance companies went, we're out of here. All right. So ultimately, by the time they're done paying the taxes, by the time they're done giving policies with no lifetime limits and having to issue policies to anybody who comes in, they won't be able to make money in private insurance. And so those companies will leave the market. That's almost a certainty. The question is, how long is it going to take? So when that happens, you are left with the government-run exchange. And the state can get a waiver from Health and Human Services under Obamacare to say, okay, well, we want to run our own plan, not the sorts of exchange that the government might set up for us. And that could be single payer. In fact, that's the logic. It's great that the student loan bill was taken over by government along with the reconciliation bill. So banks are gone from student lending. You have to get your student loans from the government now. It went along with the health bill. Started out the same way.
Because they somehow have something to do with one another. Student loans,
no, they were taking fees, and if we didn't have the fees in between us and the bank, then the government is so efficient that we would save the fees and we'd be able to give more grants. This is the same process as with the health plan. You say, okay, private companies will be the middleman for a while between the government and the individual, and then you say, oh, this isn't working very well. We can get rid of the profits of the private companies. We'll just have the government take over the whole thing. And that's where this is going in a decade to 20 years at most.
Yeah, let's make it clear that Canada, which has a single-payer system, and we took a fact-finding trip up there and found some of the horror stories. Everyone has coverage.
Nobody has care.
Well, not nobody, but not everybody has treatment. But this is an intermediary step. I don't see how this step of Obamacare is sustainable in the long run. So we know where we're going, and I think those players who understand where we're going, that's why they push things for this database.
That's why they have and I should say something too about this legislation. Supposedly the legislation is to set up a commission that will then manage the database. So they're going to come out and say, oh, well, really, we're just setting up a commission. But ultimately, the commission's authority or responsibility is to set up this database. But that's exactly right, because, and they're honest about that. I mean, I give them credit. They say, we can't manage what we can't measure. The whole point of this database is to get aggregated information so that then they can come up with, I guess, general practice on how you're going to treat specific, or certain illnesses, regardless of what,
you and your doctor say.
Exactly.
So in other words, and I think the comparison is dead on here, that we have turned insurance companies into utility companies. Therefore, the government's going to set, here's what the policy is going to look like. You tell us what it's going to cost. Okay, we'll allow you to do this, we won't allow you to do that. And so it's going to be evidence-based medicine. That is, by having these type of databases, we'll be able to say, this is the right way, doctor, to charge or to cure this issue, to treat this problem, and that's what we're going to pay for.
And if you're in the 90th percentile, maybe because you're really good at doing something, and because you use more tests or something, they're going to penalize your physician. So basically, this destroys innovation in medical care because it requires everybody to follow some statistically determined set of measures. And back to measurement, you talk to physicists, and they say, if you're using statistics, you don't know what's going on. And this is all about using statistics to control individual care. So by this light, my favorite analogy is everybody's got, the average dress size for women in America is size 12. And this kind of evidence-based medicine is, well, everybody should be treated, all women should wear a size 12 dress because that's what does best on average.
I think one of the more entertaining parts of this is we don't know what the hell we just passed. We just passed something. We just passed something that is twice the size of Moby Dick, and nobody's read it. And so, in order to find out what's in it, they had to pass it.
That's what Nancy Pelosi told you, and she always tells the truth.
So we've only got a couple minutes left. Help me understand. I don't think anybody knew, and I'm talking common people. They didn't know that now, if you own a tanning salon, you're likely going to go out of business because you're going to have to pay 10% taxes on this. I didn't know about the tampon tax. That's got to be finally one tax that doesn't apply to me. But
you have a daughter?
Yeah, I was going to say.
My daughter is not allowed to grow up, so we're fine on that. So what else? What other little surprises are we going to find?
Well,
as this comes out?
Today's little surprise was, how they said they budgeted, they use GAO accounting standards, or not, CBO accounting standards, which means they can do all kinds of gimmicks. So they said they were going to cut Medicare. Well, today they reinstated the Medicare payments for doctors, by HHS rule. The other one is that they said that children would be covered for pre-existing conditions. They were running ads like that last night. Not true, but they've beaten up the insurers now who say, well, maybe we'll do it.
But also, we're not really going to find out what's into this for 4 years, because we collect taxes for 4 years before we start paying out, and that's how we got it to happen. All right, under a minute. People are interested in this issue on 1330, and it's a stealth issue, and I don't think the left understands what it is.
I don't think
so. Where do people go? What do you want them to do?
Transparency.i2i.org, or go to the Independence Institute main page and click on the link for cost. I've got a couple of.
What is cost?
Colorado Spending Transparency. We may have to change the name to All Spending, or all Transparency all the time or something.
Yeah, it is a remarkable bit of linguistic warfare to say we're doing a Transparency Act, but the transparency is on you and not us, the government.
I give them credit.
Amy, thank you. Linda, thank you as always, and thank you. Please check out our webpage, independenceinstitute.org. Listen for me late nights on 850 KOA. Tell a friend. We'll see you next week.
Bamboozle, nuka, noozle, bippity, bop, she-gall. You jibber jab, bamboozle, nuka, noozle, bippity, bop, she-gall. I mean, you keep on talking, but you don't know where to turn it off.